I'm sure you guys have clients that are in the fitness wellness world that have BBLs or ab etching.
Yes.
And this is also why I just wanted to be so transparent. I know a lot of them, and I know that they're lying to everybody.
Sierra Nielsen, thank you so much for joining us.
Thank you for having me. I'm excited to be here.
Started off in the entertainment industry, and obviously now nutritionist, trainer. You're rededicating your life to empowering women to really be strong from the inside out.
Yeah.
The entertainment industry is so fun, and you were in it. You're at the top, and something happened. It kind of made you pivot.
Yeah, the entertainment industry is super fun. It's very exciting from the outside. But while you're in it, it was fun. I worked in TV, film, and talent management throughout that 7 years. I had a huge wake-up call when I was working in management. And that's when I was working with A-list talent, really got to know behind the scenes, a lot of the secrets, things that they were doing. It was a huge wake-up call for me. And then I went into film. But I knew at my core that what I really cared about was helping other people. Didn't matter what I was doing, but I just kept trying to convince myself that I'm helping make entertainment, making people happy, but I just knew it wasn't what I wanted to do at my core. And I was surrounded by people that all they cared about was wealth and being surrounded by celebrity. Like my last job was working for a film financier, and we made some great movies, worked with some great people, but it was really just all smoke and mirrors, and just wanted to be around famous people. So it was all ego driven. And I'm like, this is not the place that I need to be.
Sure.
I actually started a company after I left with a friend of mine. This was before influencer even existed, where we were basically a consultant agency, the go-between between tech and entertainment. Because between himself and myself, we had so many connections with celebrities and well-known people in LA. So this was kind of the time when Ashton Kutcher was getting involved with tech, and everyone's like, ooh, I want something to talk about on the red carpet that's not just acting, and they want to do something else. But in the middle of that, that's when my mom's had stage 4 lymphoma when I was a senior in college, and it came back, and that was 2014. So I sort of jumped ship, went back to take care of her. She ended up passing a year later, and that was just a huge turning point in my life. It was
I'm so sorry.
Thank you. It was a tough year for my family. We had also lost my firstborn nephew 5 months earlier. So my siblings and I just kind of rallied together. I jumped into being a caregiver, taking care of my siblings, completely avoiding myself and what I needed to do for myself. And that's when I literally hit rock bottom. And I was super depressed. I was drinking like crazy. I finally if I'm gonna turn my life around, I need to do the one thing that I never learned how to do, which was take care of myself. I'm from Lincoln, Nebraska. We never talked about health. We didn't do any of that. And when you see someone that you love going through that, it's that you are nothing without your health. Yep. So I kind of organically, just because for me it's okay, how do I learn? I just started studying nutrition and training, became a nutritionist and a trainer, just because that was the easiest way for me to learn. I didn't even know if that's what I was going to do. But then I started to see the value in it and how it was kind of a ripple effect for everything else in my life. And also got really into mental health and, personal development, and really understanding that so much of my growth was internal.
What a great pivot.
Yeah. So I've been in LA now since 2009. Been around a lot of the industry in entertainment, and now in health and wellness, and now as a creator in the influencer world. And there's a lot of issues. There's a lot of toxicity. So I try my best to combat it and be a positive voice.
So we all came to LA at the same time.
We did?
Because we came in 2009
No way.
too. The difference is Sierra came by ways of, she's from Nebraska, and then she's smart enough where she got her degree at Vanderbilt University in Nashville, which we actually have a friend, both of us from Nashville that we know.
Way.
And, Festus.
Oh, yeah, of
Absolutely.
course, Fez, he's my brother.
Absolutely.
I love Fez.
And then she landed, and it's so interesting because you're so not LA, but yet you can be because of the way you look and you've been in entertainment. But that's why everything you said in your bio and how you pivoted, it's just because of, I think, where you're from and how you were born, how you were brought up. Yeah. And it's really admirable because a lot of people get really sucked into that Hollywood space. Yeah. And interesting part about it is everything you're saying. You are really out there to help others, because since I've known you, you've really been so transparent about your plastic surgery journey, whether it's has been with me or with Dr. Layke, that it's really helped a lot of women go through their plastic surgery journey because they can relate through you. You've been kind enough to speak to our patients. I mean, you've made a video that went viral all over about this procedure you've had done. And to us, it's really amazing because we don't necessarily put people out and say, hey, listen, I operated on this girl and here's her journey. We love it when they do it organically.
Yeah,
you
someone
did
like
that
you,
for us.
yeah, hundreds of thousands of followers,
Yeah.
and you put it out there. You send a message, and we felt it. I mean,
Yeah.
people were all about it, asking, "Wait a sec, how can I do this? I didn't even know it was an option."
And if you don't mind, I'm just going to rewind and say, how did you find us? And how
Yeah.
did this relationship kind of happen? Because, we see so many people, and very rarely do we have a relationship like this, but we do. And sometimes we don't even find out, hey, how did you get referred to us? How did you find John and I?
I found you guys through a client of mine. So I have a bunch of private clients in Beverly Hills, and I want to talk about my breast lift and auto-aug, but one of the things that my entire life I've been a little bit insecure about was I had very uneven ears. I had one ear that stuck out like crazy. We could probably during this podcast on YouTube pull up my full photo that we took, because when you look back, it's kind of crazy. So I found you because my clients were like, these are the best. Oh, all my clients' kids come to you guys for stitches because they're like, we don't go to the doctor. We go to you guys because you guys are the best with stitching and with scarring. So that's how I found you. I found you guys, and they came in, did a consult. You were amazing. Ended up doing the 1-year autoplasty, and then I don't think I met with you until like a year later.
Yeah.
And for me, I had wanted to do a breast lift for years. And I probably talked to maybe like 15 other plastic surgeons, and every single one of them told me that I wouldn't be happy with a breast lift because it wouldn't give me a look I wanted, and I had to do an implant. And I was just so against doing an implant for myself, not against it for anyone else. It was just a personal decision.
Sure.
And it wasn't until we sat down and we were like, yeah, absolutely, we can make it look great. Here's what we can do. But it took a long time for me to get to a place to finally want to do it. I had a lot of pushback from people when I would talk about it in my personal life because I hadn't yet talked about it publicly. And a lot of my girlfriends were, advising me, doesn't this go against everything that you believe in or promote when it comes to self-love and body positivity? But for me, it wasn't about looking good for anybody else. And it was about comfort.
Sure.
And I realized, when we met, I was 36. I finally did it when I was 37. And I was like, I've gotten to a place in my life where I feel so comfortable in my body. I love myself. I respect myself. I accept myself. So it wasn't about that. I wasn't doing it so I would feel more beautiful, so that other people would feel like I'm more beautiful. It was literally just a comfort decision, And I also realized it was a turning point. All my girlfriends I were asking, I was insecure about it my whole life. I would never change in front of my girlfriends. Like when I hated being in a bathing suit, because anyone that has any women out there that have super saggy boobs or extra skin, the struggle. It's like tucking everything in, things flopping around, like it's literally laying on your stomach. It feels uncomfortable.
Yeah.
So I was like, you know what? None of my girlfriends have saggy boobs. They have no idea what I feel like.
Of course.
So this is about me and what's going to make me feel comfortable. And that was kind of like, okay, I'm going to do it because this has nothing to do with anybody else but myself.
And it's interesting. It's very similar to the ear. It's not like you were like, oh my God, I want to change the way I look.
Yeah.
Or, oh my God, I want to make this bigger. It's just like, no, there's something that's bothered me for a long time. And I want to just get it fixed so it looks like the other side. Or,
Sometimes uncomfortable wearing sunglasses or glasses.
Oh yeah, totally, 100%. I would, when I did my hair, that ear would literally just be poking out of my hair. And I was like, just get in there. So yeah, it wasn't about, my thing is I've never wanted to change me and the way that I look. I've always it's been about like small enhancements that would make me feel more like me.
Yep.
And that's the key with plastic surgery. What we always talk about is we're not here to change anyone.
Yeah.
We're just here to just make the person feel better about themselves. Or if there's something that's like, for example, the breast lifts or even breast reductions. I do breast reductions on young girls, 18, 19, 20. changes their life. It completely changes their life. And it's interesting because sometimes they'll be like, you're having you're making your breast smaller?
Yeah.
Yeah, obviously. You have no idea what it feels like to walk around with big, huge breasts. So 100%. As plastic surgeons, yes, we don't just do rhinoplasties to make people look perfect.
Yeah.
Sometimes their nose is so big, it really interferes with their life. It makes them feel uncomfortable doing anything. So when you give that, like that guy that you did, where he had a big hump on his nose and he had a really retrusive chin, he went from somebody that you would look at.
You heard the difference in his voice.
Yeah.
Before, very timid.
So confident.
Afterwards, stud.
Walks into the office, says hi to the girl. Like, how you doing? You know, it's great to make that change on someone's life. Why not, right?
So my biggest thing, my realization was I was doing it to enhance my already positive body image. I wasn't doing it to fix a negative body image.
Absolutely.
And I think that is super important. I forget that my sister actually was one of my biggest inspirations. My sister's a professional soccer player.
That's right. We were going to get into that too.
Yeah, she's always had huge boobs. She got a reduction the same right before I did and was so happy. And
that's awesome.
You know, they were a lot smaller and I saw how beautiful they could look because she had to have them lifted as well. And that's the thing, when you have bigger boobs and they're heavy and they sag, like, it's painful. It's uncomfortable. So I was like, oh my God, those look so beautiful. It was so easy. And you're so happy. Like, why am I not doing this? You know?
I just wanted to go into, listen, the procedure you're talking about, because you said you went to 15 plastic surgeons. They all said, look, we're going to do a lift. You're not going to be happy. You need an implant.
Yep.
Let's talk about the procedure. Maybe Dr. Danielpour, you can talk about the mastopexy, which is a lift, but with auto-augmentation.
So,
what is that?
Along with Sierra and a lot of other women nowadays that don't want breast implants, the one thing I believe in as a plastic surgeon is I am not here to tell you what to do, ever. I'm not here to tell you how big your breast should be, what implants you should use. If you have to use implants, I'll give you recommendations, but I'm here to hear you out. It's very, very important. The analogy I always make with all my patients is you walk into Chanel, you buy the bag you're looking for. I don't pick the bag for you. And this is a luxury item. You're coming into a luxury brand in the heart of Beverly Hills, and you're going to get what you want. So when I sat with you and I heard you out, the one thing you really said to me is, I don't want implants. And obviously, if I put implants in on someone, I can make them look great because you're putting a breast implant in. However, there are a lot of people out there nowadays that don't want a foreign body inside their body. And this procedure is literally the perfect procedure. So basically what we do is do the breast lift, which really removes some extra skin and lifts the breast, but also something called an auto-augmentation. So instead of using a breast implant, which would be a breast augmentation, this is an auto-augmentation, using your own breast tissue, rearranging it, and placing it up or higher on the chest, tacking it onto the muscle. So there is like a pseudo implant made from your own breast tissue. This can be plus or minus a little fat transfer if you wanted to take some fat from somewhere else and add a little bit of fat, but that's not necessary. I mean, really just rearranging your own breast tissue, taking the inferior pole, so the breast tissue that's on the bottom, and tacking to the front, and then creating a nice breast lift, in which for you, it really gave you what you were looking for. You didn't want to be bigger, you had some breast tissue, and you were the perfect candidate. You know, the one thing that's concerning, and I always discuss with every patient, especially you, is you're doing this, but we're going to have scars on your breast. And you've healed so beautifully.
So well.
To the point where I think in the next 6 months or 12 months, those scars will be completely gone.
Yeah.
And I would love to say it's magic, but I think it's a part of how you heal and some of the other adjunct procedures that we do for you with lasers and microneedling and things like that. But the reality of it is, how was your experience? What was your experience? How did this all go down? Because people are so scared to go see a plastic surgeon, get undressed in front of them.
Yeah.
Have someone examine them, and then the whole process of surgery and after surgery and then all of that. Kind of tell our listeners and viewers on what your experience has been.
I made the decision to go with you guys because you made me so comfortable. I felt so seen. You were the two that didn't push anything else on me. I've had so many terrible experiences. Like I had a dermatologist in LA 10 years ago who I went in literally just for like microderm. It was like, you should put filler here. You should do this here. We could make you a little bit more symmetrical. I sat down with you because you can go down a rabbit hole.
Yeah,
of course.
It's a slippery slope.
Especially when you're looking at plastic surgery pages, because I was looking at like what could be done. I was like, ooh, maybe my face is not symmetrical at all, and I remember sitting down with you being like, what could we do to make it? And you're like, you're being crazy. You're beautiful. None of us are symmetrical. And you're so right. So I just felt super comfortable with you guys. And again, you didn't push anything on me. And you just made me realize like it was going to be easy and I would be so much happier. It was a lot easier than I thought it was going to be.
And I
really
always play it down because there's certain procedures we do, like this breast lift. It's not a very painful operation.
No.
And I say that to people and they're like, what do you mean? I'm having surgery. I'm like, I'm telling you, you're not even going to take pain meds. You'll take Tylenol and you'll be on your way.
Yeah.
And people literally look at me like, really?
Yeah.
So
I think I took pain meds and I maybe didn't even really need them, but
sounds like fun.
It was like a week of downtime and then was back to normal and moving around, obviously not working out, but I was also very religious about that because I wanted my scars to heal well. And I did a lot of prep before. And I also think going into it being super healthy is helpful. I basically had stopped drinking. I eat really well. I move really well. And I think that I didn't even bruise at all, which is crazy because I normally really bruise.
So important what you're saying.
But I think it's also maybe your guys' technique and you're not being humble enough. Like, what is it that makes that process so easier? There are things that you guys do that made, for instance, like my case so easy.
We always say the same. It's about handling tissue, right?
Yeah.
Because there's a lot of incisions and moving things around. And the more delicate you are, and plastic surgeons in general should be very delicate, but that's the way we were trained. The more delicate you are with tissue, the better it heals and faster it heals. But it really does matter. Each individual is very different. And you took it upon yourself to really be you took this active position and I'm going to make sure that I am going to heal amazing. From before surgery to after surgery, for your scars, you listen to everything I've said. I mean, not everyone's like you.
Yeah.
The patients that do that, they always have the best results, right?
Yeah.
100%.
It's the ones that either do their own thing, aren't listening, or they come into it very distrustful, or they can't let something go, and it ends up making the surgeon, for some reason, I don't know what it is.
It's true.
It's the karma of that results in something that we would rather not have. You know, I mean, it's always the case. So it's amazing that you did that.
Or people being too nitpicky and looking for perfection.
Always.
Well, sometimes you're right. It's setting appropriate expectations, and we can do a lot, but you have to see the vantage point of where you start from, and there's so many different variables and factors. But it is interesting. I see that all the time.
And then the beauty was you chronicled this journey. And it's funny because she posted it on TikTok and it got removed.
It got banned.
And I've been banned from TikTok. I don't know even how to use TikTok, to be honest, but I've been banned from putting stuff up to TikTok, and I'm like, well, I guess it was okay on Instagram.
Which I don't know how, because there's so much crazy stuff on social media.
Oh, half
I'm
the
like, people
stuff is
are literally
insane.
showing live births on social media, and I covered my nipples, and I got to figure out a way to do it so I can give my update now, because that was a while ago, but yeah.
But it was great. And we did a little thing together, and the rest you did. And I have had more phone calls to the office and more patients that have come in asking for this because of you. And I have to say, it's amazing because you've empowered women from your experience.
Yeah.
And obviously I appreciate it because I get to operate on more people because they get to really see a real person and their experience, not just a picture of it before and after, which is always great. But this really showed you moving around, what the scars look like, how they look. And now I have people that come in and say, I want to look like Sierra. Like, good luck. That's not possible.
Yeah, we're not all going to look the same. And I think that I've had a couple people message me this, that have gone through the same thing. But I think that's what we have to realize with plastic surgery in general. Like, everyone's going for this homogenized look, trying to look exactly like each other, but that's not what this is about. It's about enhancing your own unique beauty.
You should be our spokesperson.
I know,
Yeah.
That was absolutely perfect. Like, I
but
can't
it's just in general with social media. Like, and that's where I appreciate you guys so much. Like, are you the best at social media? No. But that's why I love you, because I will not name names. There's a few doctors who are huge on social media who still to this day use friends of mine as their testimonials. And I'm so grateful that they were honest with me behind the scenes because they signed NDAs and they had horrible experiences.
Oh, wow.
And I've had to get them redone by other doctors.
Oh, wow.
And they still use them but they're big models, they're big influencers, and they can't do anything about it because they signed NDAs and they got the procedure for free.
So funny. I didn't even know about any of this stuff, but that's...
Oh, yeah. It happens all the time. I would go to sources like I would reach out to women that were influencers or in LA that I knew had plastic surgery, asked where they went, asked about their real experience behind the scenes. I would go to realself.com where real women are talking about it. And that's the thing. I don't trust a lot of people on social media anymore. Yeah. And a lot of influencers are getting it for free, so I know they can't talk about it. And a lot of plastic surgeons who care more about their social media following than their patients.
Yes.
I mean, it's true.
And you two are probably two of the few that actually care.
Your message has always been about such positivity, and I think this kind of came back at me on Saturday. So Saturday, I'm at this coffee place that's now become the hottest coffee shop in LA, Maru. There was literally a line around in the corner, and my wife's like, I want Maru. So she's pregnant, so I had to get it. So,
of course.
So I'm standing in line,
She will get Maru.
This lady comes over to me and she says, hi, you probably don't recognize me. And I said, and you know, this is always the hardest part. You're like, hi, how are you? You know? And then she grabs her kid. She goes, come over here. She goes, you stitched him up about 10 years ago. Goes, but I want to tell you something. I actually know you through Sierra. I work out with Sierra, and she has made me want to come see you so badly about doing everything after my pregnancy because she told me that she had the best experience with you. And now I've already stitched up her kids. I was like, wait, you didn't like that experience? No, but it really is amazing because you've empowered these women that have been so nervous about doing anything. And some of that stuff can't be fixed. You know, post-pregnancy changes, that's what we're here for. You know, I'd love to say like, you know, but there's no solution to extra skin or really sagging breasts. You have to have surgery to fix them.
So I forget one of your patients is my hairstylist. And a long time ago I heard about you guys did her mommy makeover.
Okay.
And same thing, so happy. And that's the thing. Again, my issue could not be fixed. I couldn't fix my skin issues. I couldn't build bigger boobs. TikTok will literally make you believe that you can, but you cannot. There are no exercises
by taking pills.
No. There's fitness people that say, here's how to grow your chest. Like, it's insane. You couldn't fix that. And especially with mothers. I said this to one of my girlfriends when she was like, you know, again, when she was talking about, does this go against what you believe in? I was like, well, I don't shame mothers for getting breast lifts or tummy tucks. And that's basically what happened to me. So mine happened over time, but it did happen I at one point was like 35 pounds heavier. And throughout my 20s, I was going up and down all the time. And yes, we all hold fat differently. It's genetic where we hold our fat. And clearly it changed a lot in my breasts. So they sagged and I had extra skin. So it was kind of returning to feeling more like myself. Not changing into somebody else, but yes, like there are so many circumstances. That's why I hate when people look down on plastic surgery in general. Mothers just want to feel like themselves again. And I get like, just appreciate, respect your body because look at what you did. Fine. That's totally fine. But there shouldn't be shame. There shouldn't be judgment.
Agreed.
You know?
No, I agree. Now,
if anything, maybe there's some jealousy and insecurity in people that are judging you.
That's
look internally.
Like that, right?
I mean, judgment usually is how other people feel about themselves.
Without
you know.
doubt. So how has the surgery affected? You're a confident person, so I'm not going to say you're confident.
Oh, it changed it completely.
But what about you? I know you work out a lot.
Yeah.
Has that changed at all for that or not? Or
no, because I don't have implants. Oh, well, working out, it's the same. Like I've worked with a lot of patients that have implants and they're very limited. That's another reason why I didn't want implants. I know things have changed in the way that you do implants, but it was the best decision I ever made. Like I am a confident person in the sense that I learned to respect and love myself. My view on self-love and body positivity is a little bit different, I think, than other people because I do not expect you to look in the mirror and love your body every single day and love every single part about yourself. I just want you to respect yourself and I want you to respect your body because your body, what I realize is like, I'm not defined by my body and the way that it looks. I'm so much more than that. But I showed up in the world a little bit different. I literally went from someone who was, again, hated being in a bathing suit. My girlfriends had never seen me naked ever, to being like literally some of my guy friends. I was like flashing everybody. I was like, you want to see my boobs? Like,
I love it.
I'm walking around the house without a top on by myself feeling comfortable.
That's
Never
so
did
great.
that before. I would immediately put a towel on. So again, it was all about self-confidence. Like with intimate partners, totally different. I wouldn't be so shy. I didn't have to have the lights off, you know. It changed everything.
That makes me feel really good.
You know,
Thank you.
and
You know, I was kind of segueing to talk about your fitness kind of,
Yeah.
you're a personal trainer, right?
Yeah.
And if somebody wanted to get personal training sessions from you, or how does that work? And how do they find you? Just on, let's
yeah, I
talk
mean,
about
most
that.
of my, right now I do private training where I go to clients' homes in Beverly Hills. So I have a very small clientele because my goal is not to be, I did when I first started and was like going through it. I worked at a sports performance facility. I was training under some of the best people ever. And then I was training all day long, but I knew that's not what I wanted to do. I am not a trainer online that like geeks out on personal training and nutrition. The science behind calories, I want to help you move better. I want to help you, like, again, I come from Nebraska. I didn't know anything about nutrition and health. Yeah. And like what we thought was healthy was not healthy.
Yeah.
So I just want to help educate people.
Nebraska healthy.
Oh yeah.
Wisconsin
like just
healthy.
like a Cobb salad, like slathered in everything, you know,
that's salad.
You might as well have a burger, you know?
That's so funny.
And then I went to Nashville. That didn't help, you know? There's nothing healthy in Nashville. So I kind of forgot what the question was, but being
like if people wanted to find you for personal training.
Me, yeah. I mean, people email me, DM me, but all my clients have been through referral, you know.
Amazing. Okay, so I can refer them directly to you.
100%. And I'm not for everybody. I'm not a boot camp trainer. I'm not going to yell at you. If you come in and you're super tired, I'll probably tell you to go home because sleep is way more important. I care about your stress. I care about, you know, I work with mostly, except for a couple of my clients are mothers who run their own businesses, who have kids. Like, I'm not going to tell you no excuses. I'm just not that kind of person.
That's great. My kind of trainer.
Yeah. yeah. But again, I want to empower you and it's about making you feel good. It's not about making you look a certain way. I want you to feel strong. I want you to feel energized. And that's really what it is, you know?
Amazing.
And it's so hard being a trainer and being a trainer online. It's much like, you know, I'm sure you guys get this, you know, a lot of people think that plastic surgeons are just preying on people's insecurities. And I get, you know, a lot of personal trainers and a lot of influencers, they feel the same way. We're saying things just because we want to sell something. We prey on their insecurities. There are people that do that. There are people in your profession that do that. Mm-hmm. But there's a lot of good in it as well. And so for me, it's like, how do we combat that? And there are a lot of people which I'm sure you guys have clients that are in the fitness wellness world that have BBLs or ab etching.
Yes.
And this is also why I just wanted to be so transparent. I know a lot of them. And I know that they're lying to everybody.
Sure.
And I refuse to be that person. I have too much integrity to be like, oh, this is how I built my booty by my program, you know?
Yeah. Bravo to you. It's great because, you know, it's all smoke and mirrors now. Like, no one knows what's real. No one knows what's not. And that kind of brings me into this other question, and you cannot answer it if you don't want to. I know it is very difficult to date in this town. And you and I have talked about this a bunch because since I've met you, you are so lovely and you are so beautiful that we talked about this for a second. Any luck?
No, but I also am not you know what's so funny?
Oh, because I'm advertising it right now. Okay, just so you know.
No,
I'm throwing it out there, guys.
It's really hard. It's so hard. Most of my relationships have been through referrals, people setting me up. I'm on the apps, you know, I'm on Raya, I'm on Hinge. It feels kind of like a game, but I will say when I get on Raya, I'll switch to the women because I want to see who's out there. What am I competing with? Or I don't know, maybe I'm interested in women at this point. But there are so many beautiful women in LA who are just, if you look at them without knowing who they are, perfect skin, perfect hair. You can tell they've had a lot of plastic surgery. They're younger than me. I mean, I'm 38. It is really difficult to navigate it and to try and find, you know, there's just so many readily available beautiful women.
Yeah, it's a tough city.
You know, it's a really, really tough city.
Because most of the guys want to, they want to have as much fun as they can for as long as they 100%. Possibly can.
And they don't necessarily care about a woman who's like super driven and intelligent. They're in this town.
Yes.
And I've had conversations with some of my guy friends who are very successful and they will admit it because, you know, they don't care if they have someone that's just really beautiful and fun and that can
It's a
basically
short-term kind
a
of,
short
yeah.
term can go wherever they go. So I'm like, well, damn it, what do I do?
So for all the moms that are listening to this
Yeah.
podcast right now, she is amazing. Okay, so if you've got a nice son, send them our way, and I'll
I
set it up.
mean,
Okay.
yeah,
No,
I'm-
I've said this to you every time I see you. I'm like, okay,
I'm
I gotta
open.
find, but I
it's
just don't have
hard.
anyone.
Well, but every time I talk to guys that I admire and respect, they say the same thing. I mean, yeah, I've got single friends, but I would never set you up with them. Like, what
Yeah.
is wrong with
Yeah.
men in this town? You
No,
know?
but it is. It's really gotta just hit you in the face. But yeah, so everyone that's listening, guys, send them over. I'll vet them out for her.
But it's also, that's why there's so much pressure to feel like I need to be doing all of the things. You know, all of the lasers. Do I do these tweaks because am I good enough? Am I gonna,
You're more than good
compare
enough.
it?
Yeah,
Yeah.
that's-
So
that's-
it's-
That's without a doubt.
But that's where, there's so many different factors at play. There's social media and what it's caused, filters. Like,
Yeah.
people probably
toxic.
come in and they're like, I want to look like this because, it's, well, not even, and like COVID and what do they call it? The Zoom boom.
Yep.
I get celebrities. They're constantly in the public eye
Sure.
and constantly nitpicked. But now we are too.
Yeah.
We were all in front of Zoom, and now everyone wants to be a creator. It is so hard for me to watch stuff back, and I'm like, oh, well, like, why is my face doing that? Like, do I need to fix that?
Oh.
We become hypercritical of ourselves. And so it's, it's tough.
Yeah.
And so I guess, like, that's also why you guys do such a good job of relating to clients and patients and be like, well, that's normal. Most people are like that.
You definitely don't need a facelift.
Yeah.
You definitely don't.
Well, so you know what?
anything.
That's a new thing. I've thought about it because everyone's talking about the new trend between
do it
35
younger
and
and
40
younger,
to
yeah.
do young facelifts. And
Oh
I
yeah,
was like,
I missed the boat.
should I be doing that? But
it is crazy. The advent of social media and the way it's propelled forward is,
Yeah.
I mean, it's such on a toxic level that now we're looking for that validation at any turn, and it's not real.
do
It's
you
not
guys
real.
get a lot of really young clients coming in now?
Oh yeah.
So how do you manage that? Obviously, as
I'm gonna let
plastic
him-
surgeons, you've got to be careful about what kind. You guys knew with me that I was in a good place, but like a lot of young women, I'm so glad I didn't do it when I was in my 20s because I was dealing with body dysmorphia and not loving myself. But like, how do you manage that?
There's a lot of redirection, and
Yeah.
essentially our therapists as well. I mean, the
Yeah.
idea is you have to be able to evaluate things that would affect their postoperative course, and mental illness is one.
Mm-hmm.
And so there are certain questions that we ask. We want to know not just like, why are you doing this?
Mm-hmm.
We'll kind of skate around it and say, all right, if you had to list 3 things about this particular body part that you would change, what would it be? When you list off 7 or 8 things, now we say, all right, this is more of an obsession, as opposed to someone saying, you know what, I kind of like the structure. I just want to make it look a little better, different ballgame. And that's a person who's even keeled and sees the potential. But there are people that come in and say, look, my inspiration is Margot Robbie, and this is what I want.
Which
And
they don't realize Margot Robbie's had a lot of stuff done.
Yes,
But
but whatever she's had works for her.
Yeah.
You have to look at your own facial structure, your own body structure. We have a patient that comes in and she's just an athlete, big bone, whatever. You are not going to be a Kate Moss. It's just not going to happen.
It's just not.
And so,
Unless you go do a lot of Mounjaro or Ozempic.
man, but even then,
Yeah.
it's just, but I think it's a lot of redirection. Like, okay, here's what I think would benefit you. Here's what I think would send you in the opposite direction.
He's great at handling, especially very young women and men that come in and want a ton of facial stuff done, like really want to get changed. And I think John really handles it very well because I know that other people are just like,
I know
you're going to pay me?
Go next
Yeah.
door and someone else will do it. But
I
just
was
different.
thinking about this the other day because there's a lot of TikTok women who are like 20 to 24 who have done a lot of filler.
Yep.
Lips, face, Botox, everything. And I want to talk about maybe the dangers of doing that so young, but also I was like, man, if I were to look back at my photos when I was 20, I recognize myself and I know what I looked like.
Yep.
How weird is that to then look back and be like, well, I don't even know what I actually look like.
It's interesting. I'm going to have him answer it. So I'm
Yeah.
just going to say one thing. In your 20s, you're 20 to 24, you don't need filler. Nobody should really
I don't
be getting
understand it. I
ton of
had like a
filler.
baby face, and then people doing buccal fat or however you say it,
Yeah.
remover.
buccal fat.
When you're that young, like ladies, that's going to happen when you get older and you're going to wish that you didn't do that, you know?
Yeah.
That's when we age or when you lose weight,
And the sad part is, I'll tell you, and again, he'll touch on it. These kids sometimes are being brought in by their mothers.
We obviously see a little microcosm of the rest of the world, really. So I think that Beverly Hills is a different beast. It's a very tough city,
but maybe
and,
not anymore because with social media.
Well, you're right.
Now
You're
it's
right.
everywhere.
Well, now there's access,
They're
but
looking-
people are still
Yeah.
coming to Beverly Hills expecting
100%.
Whereas you go to a plastic surgeon in Wisconsin, and they're going to do their best, but I think they still will say, "Look, I don't even know, let alone who this person is. How can
Yeah.
I?"
Yeah.
But it's not that they're not good
Yeah.
plastic surgeons.
Yeah.
It's that the mentality is different.
Yeah.
The expectations of the patients are different, and so here it's really tough. I mean, in your 20s, do we take care of people in the 20s and give filler? Yes, but it's people who are genetically predisposed to having no volume, or they, and so you add something to give them little lips. You give them,
Yes.
I just saw a patient the other day. She was 23 years old. She genetically lacked all central volume in her face.
Yep.
And so she already had the development
Yeah.
of under eye bags.
Yep.
That is not normal for a 23-year-old.
Yeah.
And so that's where you can handle some volume. But overall, when people come in and say, look, I want to look like this anime photo, you're like, you're in the wrong office.
So if you're doing it really young and getting all of this filler affecting your skin, right? And it's something you're going to have to constantly do, or do you feel like then it's going to make their skin more wrinkly if they stop doing it? Like why would you advise young women
Well, listen,
to
you always run the
chill on the filler if they're not one
Yeah.
of those patients that like you already have a beautiful face? I don't know why you're trying to plump it up.
It's a great point there. What I would say is that anytime you inject under the skin, remember, we don't have x-ray vision. So you have the risk of hitting blood vessels, which could knock out a little fat pocket in the face. You have the risk of having a vascular event, meaning, let's say we inject into a blood vessel and all of a sudden the tip of the nose goes black, or, lips, have wounds, and you can run into issues. I have a patient right now that she was injected with a filler in her mid-face. And for some reason, chronically, for the past 2 years, it swells and gets infected, and then they give her antibiotics and it goes away. Filler, we say, can last for a finite period of time. Sometimes it lasts for a long time, depending on where it's placed.
I've had a lot of people that have had issues with
Under
under eye
the
filler,
eyes.
and then it all of a sudden turns into a mass right here
Yep.
You're right.
Yep.
that had
Because
to get removed.
Because there's too much put in, it's not
Yeah.
done properly,
Yeah.
or
or
you
they're not
pierce,
candidate.
you pierce through something called the orbital septum.
septum.
And once you do, the filler can't go anywhere. It just
Yeah.
fills up a little hammock that's under the eye.
Interesting.
And it's hard to get rid of that. So
Yeah.
I would say in your 20s, you do it when you have to.
Yep.
If you already have full lips, there's zero reason to do it. Zero. All right. And so for those of you who have no lips, okay, then come get a little bit of filler, and
Yeah.
it's not the end of the world.
The one thing that you did that I loved, I need to come back and do it because I love my lips. But again, our faces, if you look at what I like looking at that map to show where all your muscles are, and you realize just how complex your
Intricate,
face
right,
is.
definitely.
Is one side of my face is totally different than the other, and like my muscles are different, you
Very,
know?
very, very
And like,
common.
yeah, when I smile, once I lose one side of my lip, so we did a Botox there
Yes.
that lowered it, and I was like, oh, I don't need filler. I
Yeah,
just
Yeah.
need the
tiny
Botox
little
right
things.
there.
Well, I always say we're two
Yeah.
pieces that fuse in the center.
Yeah.
So we're all asymmetric.
Yeah.
In fact, when I do all of my rhinoplasty, we do a Vectra 3D imaging, and there's one element where you click on a button and it splits the face into two lefts and two rights, and you put them all three next to each other, and you look like three different people.
Yeah.
But I do it for two reasons. One is because sometimes in a nose I'll say, all right, I'm going to replicate this side. But the other reason is to show the asymmetries, because it is so normal. But when we look at one another, our brains naturally
Yeah.
take the better half and
Yeah.
replicates it constantly. So that's why the common phrase
Well, it's
they
like
look better in person.
You guys saw everyone doing the filter on TikTok where Have you seen it?
Which one's
Where
that?
it'll put one side of your face together.
Yep.
Yeah.
And so you can see it where you're like, wow,
Perfectly
I am
symmetrical.
not at all symmetrical.
No, nope. Everyone.
But-
It's 100% of the people in the world. You
Yes.
put them next to each other.
You
it'll
know
look
what
weird.
I did when I went down a rabbit hole of like, okay, what could I fix it? And I stopped myself. I went and looked at some people that I think are incredibly beautiful. And I was like, wow, they're not symmetrical at all. So why
Nobody.
do I think that I need
You're
to be
right.
symmetrical?
You're right.
I grew up where Facebook started when I was a freshman in college. And that was just a networking thing. I mean, it wasn't until I would say maybe the past 7 years where it became what it's become. Before
Yeah,
it was
sure.
connecting with people. And now it's the creator influencer economy. And, you know, growing up, yeah, we had magazines but we weren't inundated with it every single day.
Mm-hmm.
And like, you know, you look at stuff like Ozempic too.
Yep.
We're like a third of the country's on Ozempic right now. And that's another transparent thing that I like hate people. Just admit it. Just talk about
I
it. Don't tell
agree.
me that you're doing it. I know, and if someone is losing that much weight rapidly, you're not doing it by yourself. You're using something, or something's wrong.
Yeah.
Or something's
you could be
wrong.
sick.
I saw a
Like-
friend of mine not long ago. I haven't seen him for a couple months. I said, "Wow, you lost so much weight." He goes, "Yeah, I stopped drinking." I go, "You're an alcoholic? Like,
Yeah,
what,
yeah,
what do
yeah.
you mean you
Yeah,
stopped
I mean
drinking?
that
You
does
can't
make a
lose
huge difference.
That much weight?
Oh,
Like,
but yeah, no.
So it's
But
like, just
but they'll
own up
say
to
like
it.
I started a new workout, but just
Yeah.
don't make people feel bad, you know, because you're not a better person for making us believe that you did this on your own.
And the interesting part is
You know?
all the studies that are coming out about these gluten inhibitors or Ozempic or Mounjaro, any of them, they're all very positive.
Yeah.
It's showing that it is going to be a longevity medication. It's going to make people live longer because it's decreasing sugar levels in your body. That's really what it comes down to
Yeah.
in a very simple
Yeah.
way.
Yeah.
And we know that sugar is bad for all our organs, well, our kidneys, our heart, our blood vessels.
Extra
so,
sugar.
you know, and also on our skin.
Yeah.
And also knowing that extra weight is really bad for all of the organs in our body.
100%.
So if you can find a way to help people that have a food addiction problem, well, wow, that's amazing. You're going to, especially in the United States, you're really going to help a lot of people. And I don't think there's a problem. Just own up to it. Who cares? You know, like
100%.
it is what it is.
We need more transparency.
Yeah,
I mean,
yeah,
like,
yeah,
do you
that's the
guys
issue.
feel like celebrity influencer, like, how do you feel about the social responsibility of being transparent?
I mean, I think that's paramount. The
Yeah.
idea is, let's take an actress. They have all the responsibility to let all the young little girls that are looking up to them know that if they were taking a medicine or they had a procedure or something to get them to where they were, for you to deny all that is devastating to younger children who they feel that they have to live up to that. And so I think
I mean, it's the expectations too. Whether you see it in skincare, body, like if you just do what I'm doing, you can build a booty like I'm doing.
Yeah,
If
it's
you use
ridiculous.
this oil
Magic.
that I'm using, you know,
Yeah.
J-Lo, like my face will look like you. It's
Yeah.
so it's like if you just work hard enough, like I do, but you're not. You're lying. You're not being honest. You're not. You know, I get it's each to their own. You can admit it or not, but I have a problem when you come out and say this is how it happened.
You know-
Just don't talk about it if you're not gonna
Yeah.
admit it.
It's
right.
interesting because in our experience over the last 15 years, the A-list celebrities that we've worked with, it's all hush hush. The reality stars, they're like, let's tell everyone.
Yeah.
And
Yeah.
it's interesting because they don't care.
Yeah.
And they'll come out and say it. As much as I think reality TV is, it's not for me, I don't watch it, it's a little bit cheesy. The stars that are on it that are influencing people that we've come across, they've all been incredibly transparent, and they've screamed it from the rooftops because they feel like, okay, if I can help someone with their journey of whatever I'm having done, well, hopefully that'll help.
As long as they're doing it for that reason.
Yeah,
There's
yeah.
a good or bad.
Yes,
Because
yes.
now influencers are literally using cosmetic procedures as good content. This
Yeah.
is gonna, you know, and then it goes too far. And I can see and
No, I
watch a
get
lot
it.
of them. You're doing this because you do not love yourself.
Yeah.
Yeah.
You know, and again, it needs to come from a place of, you know, again, enhancing positive body image, not fixing negative body image.
No,
you
very
know,
true.
to some extent. You know,
Could be a
but-
double-edged sword.
100%. So yeah, I mean, I realized that when I worked in entertainment. I remember I realized, oh God, what it was like 2011, and I realized, oh my gosh, they're all taking like HGH. No one talked about that, and now everyone talks about it. But like back then, every single person was on HGH, you would see, I'm not going to name names, but like big male actors get ready for a movie shoot, and you had no idea they were being pumped with steroids.
Yep.
Like you cannot build that much that fast,
Yeah.
you know?
Yeah,
But
yeah.
again,
I've had a great
everything's
trainer for this movie. And you're like,
oh my gosh, don't even, I have some friends that are celebrity trainers that will go out and say stuff in magazines, you know, with their clients that have had BBLs and take credit. I'm like, I could never do that.
Nope.
Like, yes, they're working out. I wouldn't say necessarily working hard, but like, yeah, I just wish there was more transparency.
yeah, that's human nature. We've definitely worked ourselves into that.
Yeah.
I know.
That's just why I feel like I wanted to be so open again, because we went back to like, I didn't know this was an option.
Well,
I did so much research, looked at so many, and you were the first person that told me, oh, look, this is what we can do. And I guess I forgot to ask you, like, is it because this is such a new thing and like other doctors don't really know how to do it?
This has been around and it's described for a very long time. And it's very interesting that this is a procedure that one of our plastic surgery clinics that we had. And when we were in residency together, we'd show so we had our own resident clinic, and we'd have cases, and then we'd come up with a plan. So one of the patients that I said, I'm going to do this breast lift with an auto-augmentation. I put the picture on the wall and went over it, and multiple surgeons actually were like, that doesn't work. And I said, well, I'm going to do it anyways, because there's a scientific paper that shows that it really works. Patient doesn't want an implant. So I started doing that a long time ago, and then kept doing it in practice. And now over the last couple of years, that the whole breast implant scare has been there again, because people are like, oh my God, it's breast implant illness. And I'm not going to get into that during this podcast. But so I said, okay, we have to give people another option. And this auto-augmentation is a fantastic way to do it, as long as the patient has some breast tissue and so forth, so on. And I've had great results and really good success, and I'm so happy that you're
So why
happy.
do I feel like literally no one else I've talked to mentioned that? Why are other plastic surgeons not bringing that up as an option?
Because it's, first of all, it's easier to just stick an implant in.
Yeah.
It really is. It costs more money for the patient. And listen, that look of having an implant, sure, for what that look, it's amazing. But a lot of people don't want it, so you have to give people
It has to be the
option.
appropriately selected patient. You had some breast tissue.
Yeah.
Not everybody. So some people come in, and if it's just skin, you can't really do that procedure because there's not enough of an auto implant. Right?
But would they be able to, in that situation, do fat transfer?
Sure. So we do a lot of fat
Okay,
transfer
okay.
still, and
Yeah.
did
Well,
it
But
multiple
it's still
times.
harder
It is,
unless
well,
you
a
have
lot
like
of scenarios
some.
are, let's say you have just skin. You also don't have a lot of fat.
Yeah, that's true.
So
That's
it's
the
kind of
problem.
like you're
That's
stuck,
true.
and that's when
That's
the
true.
implant comes in, and we just see it's easier and easier. So when you have these Beverly Hills moms that come in and they're thin and they don't have a lot, then it's easier just to go right for that implant. But if you have just the right combo, this procedure is phenomenal.
I'm just glad people know it exists.
Tune in to watch more videos just like this one.
Many people get post-surgery blues. Sometimes this is a combination of the narcotics you've received from surgery, the pain, the discomfort, the pressure, and it's really interesting because some people have depression.